Holly Pautz, physician assistant. As a PA, I do basically everything that my supervising physician does. If I have questions, I'm able to go to him and ask and consult with different cases. It depends on the situation that you work in. Here at the clinic, with Dr. Sippel being male, me being female, I sometimes see more female patients for well-woman exams, things like that, which is one interest of mine. I think some women are just more comfortable seeing a female provider. I try to listen, I try to use my own experiences to be a better PA and to make their experience more comforting and make them feel open so that they can ask the questions they need to ask and tell me the truth about their health history so that I can give the best diagnosis. I think my role as an educator is a huge portion of what I do. Each illness or disease process has its own information, and if patients can understand what's going on and why their body is doing what it's doing, then they can understand how to fix it. So I think educating them as to what's going on with their bodies is a first step in getting them to really be accountable and be part of the process of treatment. I have been married for 4 years. I have an 18-month-old daughter, and we're expecting another baby in a couple months. I think that after having my daughter, I have a whole new understanding and respect for what it is to be a parent. I can empathize with the parents now, and I can understand that when their child's sick, they just want a phone call back if it's just reassurance to say, hey, everything's okay. I think that I'm able to put myself in their shoes and kind of understand, when they're asking the questions they're asking, what kind of a response they may want, or what kind of the response they deserve. I try my best to educate my patient as to why we're doing something, not just that you need to do it. So if a patient doesn't want to take a medication, I really take the time to educate them on what the disease process they have is and why it's important to take certain medications or to do certain things. Oftentimes just that bit of education to let them know why they're doing it is enough to get them on board. Again, ultimately, and I do let them know it's ultimately their choice. Sometimes I'll let them go home for a week or two, think about it, schedule a follow-up visit. They come back and are ready to get on board. I guess I just want my patients to know that I'm open to listening to them, and I want to provide the best care that's for them. And I understand that not the same care isn't the best care for each patient. So I want them to know that I'm here to listen and I'm here to help them, and all they have to do is come through the door and we'll be here.